Good morning, everybody, or should I say howdy? Greetings from um, our full Texas Action for Healthy Kids group. We are so very thankful that you are taking some time out of your very busy schedule today, and hopefully tomorrow as well, to be joining us for our annual Texas Action for Healthy Kids Summit. My name is Alice Kirk. I am with Texas A&M AgriLife Extension. I am an Extension Child Health and Wellness State Specialist based out of College Station. And I am incredibly honored to also serve as the Texas Action for Healthy Kids Steering Committee Chair. And today I will be serving as the moderator for our conference. And so I wanted to go through a couple of just logistics before we kick off. Michelle? Great. Okay. So some of you that have joined us in the past, we want to say welcome back. Thank you for returning to one of our events. If you are new, we just wanted to kind of go over some of the logistics of kind of how the day is going to work. We would ask that everybody be please put on mute to get us kicked off. We are recording the session, and so we're really going to try to avoid feedback and so forth. Any technical issues. You're welcome to listen in on your phone and your speakers on your computer. If you do have a question at any time, please feel free to put it in the chat box. Michelle, just a few minutes ago, put the agenda for today into the chat, as well as the bios, I believe, for the presenters that you'll hear from, some today and some tomorrow, if you're joining us tomorrow as well. In addition to that, just to let everybody know, any of the resources that presenters reference or are utilizing will be provided following the webinar. And in addition to that, since we are recording, should you have to step away for something urgent, we will be also sending out the recordings following our sessions. But we hope that you will be able to stay on and participate throughout the majority of the sessions, because we think you're really going to get a treat with our annual summit this year. The committee's worked really hard to pull together some excellent panels. So let's see. Again, some of you may have already started doing this. We would love to see and learn a little bit more about you, who's joining us. So if you would, I'll give a minute or two, reintroduce yourself, rename yourself with your name and the organization that you are representing, if you wouldn't mind, or just put your name and your organization in the chat, whichever is most convenient for you. But we would like to know a little bit about who is joining us today. And while you do that, I'm going to go ahead and kick us off and just give a little bit of an update for those of you who may be new to Action for Healthy Kids, and tell you a little bit about who we are, a little bit about our organization. So we are a group that is in lots of ways serves as an umbrella. We were developed as a group. I guess it's been really since 2002. Action for Healthy Kids has really been working and engaged with schools around nutrition and physical activity since about 2002. And that was when Dr. David Satcher, who you see here on the screen, and at the time he was the Surgeon General, he declared that we had an obesity epidemic. And so at that time, teams from all across the US gathered in Washington, D.C. to really work on how do we begin to develop strategies that would pull together teams and resources that could identify those impactful strategies that could make a difference in children's health. And so at that point, our Texas team began the work of coming together. And here in Texas, I am very biased, but I will say we have one of the most amazing Action for Healthy Kids teams because we really do a concerted effort to bring together all interests related to school health so that we're all working together collectively on school health issues, whether that be at the local level, at the district level, and certainly at the state level. Next slide. I keep referencing we. Y'all have heard me say we. That is because we are very fortunate in Texas to have an amazing steering committee. What you see on the screen before you are organizations. Many of them represent state level organizations. You'll notice some school districts that are actively involved, and certainly a number of community partners. And so what you see is that we've got wide representation from across the state. And our team has worked very hard. This collective panel that you see here listed has worked really hard on pulling together the agenda and pulling together the speakers and panels that you will be hearing from today and tomorrow. So I want to say thank you to all of our steering committee members. And I would be remiss if I didn't say we are all in awe and honored and led by our amazing Miss Michelle Smith, who is our interim supervisor and family school partnerships programs. She is at the National Action for Healthy Kids group, working in some amazing roles to support Texas and bring. She's a really great connection between the work that Texas is doing and the goals that National Action for Healthy Kids is doing. She serves as an amazing voice for us, and we are excited to have her leadership here in the state of Texas. Thank you, Michelle. Throughout the day, we will also touch on a couple of our resources. So you'll see here, we've got some fantastic pieces that over the years we've been able to work together with partners on. Action for Healthy Kids is able to provide some grants that support physical activity and some sound nutrition. Recently, they've also done work with social emotional health. There are a number of resources that they developed over the COVID pandemic era. And then we also will, at one point we were doing almost monthly. Now we kind of do, every other month or quarterly webinars and trainings that are available. But later on today, you'll see the website where we also have a number of recordings for trainings that we have done over the past that you could certainly still have access to if you're looking for maybe some information on a particular topic. But there's a wealth of resources that Action for Healthy Kids, in partnership with groups like Texas A&M AgriLife Extension or Catch or TDA or any other number of resources, have been able to kind of develop, and then we like to have them available for everyone to use. Next slide. And as some of you may have heard, as a part of a cooperative agreement that Texas, or that National Action for Healthy Kids has had, they have been able to develop and put out and provide over $30 million million in subgrants to 264 school districts across 44 states and the District of Columbia. And these Healthy Meals Initiative and Healthy Meals Incentives grants were open specifically for small and rural school districts. And as you see the note from Michelle, here in Texas, we've got 16 school districts that applied and were awarded funding. So that is amazing. And so the Healthy Meals Incentives Program, you see the web link there. That was kind of the information about those districts that were recognized and states. I think this has been one of the most amazing projects that we've had the opportunity to support here recently. And so it's great news. Oh yeah, good point, Michelle. She just noted that all districts can apply for the actual recognition program, and we will touch a little bit more on that either today or tomorrow, and we'll include some information about that particular recognition. It's really intended to kind of spotlight innovative practices that your school districts might be doing with both student and community engagement. And so I think that's really going to fall well into the focus of our entire summit. And we'll talk about that in a little bit more detail throughout the summit. So to just kind of kick off where we're going today, our overall theme this year is connecting the pieces. How are we working to support the whole child? And I think as you look through the day and you look at the panels that are going to be presenting today, you'll see how the steering committee really wanted to call upon all the different facets and components of the whole child. So we're going to start off here shortly with a panel on connecting the pieces, looking at various components. Then we're going to jump on at about 1 o'clock, just after. We'll turn our focus on mental health, both student and staff, and talk a little bit about some work that's being done in that area. We will then have a little break. We've got a great Catch Global team that is always very supportive and serves on our steering committee as well. So we've got a group that is going to help lead us through a couple of some little stretching breaks, and then just give a little break from all of the sessions. We'll come back at 2:20 and begin our conversation on physical education. And we've got a fantastic panel working on that. And then I'm really excited about our 3:30 session today. We've got a panel of 6 youth that are going to help share their voice and their discussions related to the whole child. And so they'll join us. And then following that, we'll do kind of a wrap up towards the end of the day. And so that's what the afternoon is going to look like for everyone. Do I have any questions right now before we kick off? Okay. If not, I will remind everybody, if you do have questions, submit them in the chat. And we've got Michelle and another one of our steering committee members that are going to be following along. Miss Sandy Bristow also helping kind of keep track of any questions that will come up throughout the day. Okay. So before we kick off our very first panel, I wanted to just touch on, I realize I'm preaching to the choir here. We recognize that our children spend a majority of their day, really more time awake at school than they often do at home. And so as a collective group, we start to think about the impacts that children have regarding their physical and their mental health, and when they're going off to school and in their just everyday life. What are the challenges they're facing? What sort of behaviors and you see here on the screen, these are just some of the ones that I think if any of us were to ask people in our schools, ask parents, etc., these just quickly come to the top. And so we wanted to hone in, although there are a number of these and several of them kind of relate to social emotional health and physical health and nutrition. The focus of our summit today and tomorrow is really going to hone in on all things related to physical and mental health, and what we can all do, what you can do locally in your space to support efforts that are going to make an impact in these areas. Next slide. And as we start looking at that, one of the ways that we really like to take the approach is, as I mentioned earlier, the whole child. So we like to follow the WISC model. And so if you hear us reference the WISC model, this is the model that we're referencing. And it's really short for the whole school, whole community, whole child. And so we like this model because it incorporates the components of an effective school health program and the tenets of that whole child approach to education. And it really looks at that symbiotic relationship between learning and health. And in particular, as you can see here, it breaks down the components, but it takes into account that the community and the environment is a really important part of this model as well. Although it does continue to focus on the traditional coordinated school health approach, it also aligns the structure and the framework with objectives that education has, as well as the fact that every facet, parents, students, staff, and community, play an important role in the child's development. And so throughout the day, keep that in mind. Okay, so I am now excited to introduce our first panel. We are going to, kind of taking from that WISC model, we have pulled together this amazing panel representative of various school districts, but we have Miss Brandy Bolin, who is our Region 4 Education Service Center representative. We have Amanda Kennington from Goose Creek ISD, Allison Thummel from SHAC, the SHAC chair in Fort Bend ISD. And then we also have a community partner. We have Miss Luz Waters from El Paso, representing the AgriLife Extension Expanded Food and Nutrition Program, or FNEP, out of the El Paso area. So let us kick off. Are all of our panelists on? Let's make sure. Yes, can we see? Yes, everyone's got. Perfect. Okay, so what I would like to do first is to begin by kicking off and asking each of our panelists to please introduce themselves and share a little bit about what their current involvement is with school health, in whatever facet that is that they support school health at this time. So let's start off with Allison.
Hi, everyone. My name is Allison Thummel. I'm a registered dietitian and personal trainer / exercise physiologist by background. I am a parent volunteer for the Fort Bend ISD SHAC. I am currently in my second year sitting as the chair. I do have one in college and one in high school in Fort Bend ISD. I sit, in addition to the chair, I'm on 2 campus wellness committees. I work as a parent volunteer for the high school. And then my daughter also goes to the Culinary Career and Technical Education Center in the mornings. And I sit as a parent volunteer for that campus wellness committee. I've been involved with the SHAC, the School Health Advisory Council, for 7 or 8 years now. And it's been a big blessing. So thank you for inviting me, and I look forward to this event.
Perfect. Thank you, Allison. Luce, would
Hi,
you
everyone.
introduce?
Yes. Hello, everyone. My name is Luz Waters. I am an extension agent for Texas A&M AgriLife Extension as part of the Expanded Food and Nutrition Education Program, also known as FNEP. FNEP is dedicated to assisting families and youth with limited resources. FNEP offers essential lessons to basic nutrition, food preparation, food budget management, and food safety in settings that are convenient for participants. Our youth program engages students in a series of educational lessons on nutrition and food safety as part of the classroom, after-school activities, and summer programs. Through FNEP, youth are empowered by learning to build a healthy plate, set limits on sugars, fats, and sodium, be active, food safety, and practice healthy behaviors. Extension in El Paso and the FNEP program has formed partnerships with 8 different ISDs throughout El Paso County, providing evidence-based curriculum to students and parents working collectively to enhance children's health. I have also partnered with the American Heart Association to establish client choice food pantries in 2 local school districts to help address food insecurity. Lastly, I'm a member of the SHAC and the Healthy Schools Coalition, where we continue to make strides on promoting the well-being of our youth.
Perfect. Thank you. Amanda.
Hi, everyone. Thank you for having me today. I'm very thankful for this opportunity to talk with all of you. I'm here in Baytown, Texas, east of Houston, and I am the honorary Healthy Community School Coordinator, long title, but pretty much what that means is that my role is it's designed to encourage innovative ideas, try to, whether that be with physical education, anything within that WISC model, really, but I promote and support and try to sustain our coordinated school health programming here in Goose Creek CISD, which happens to be our CATCH program. So very thankful for that partnership as well. I'm also the SHAC facilitator. This is my 3rd year as both the Healthy Community School Coordinator and the SHAC facilitator. I do have 17 years experience as a physical education teacher. Kinesiology is my background. Went into the classroom for 1 year as a 3rd grade teacher, and then the pandemic hit. And then the past 3 years, fortunate to be working here in Goose Creek. So I'm just happy to be here and share some of the experiences that we've had really the past 3 years with SHAC and overall. So thank y'all so much.
Thank you. Brandy.
Thank you, Alice. Good afternoon, everyone. I'm Brandy Bolin. I am a nationally board certified school nurse, and currently I serve as the school health specialist at the Region 4 Education Service Center. I also serve on the steering committee for Texas Action for Healthy Kids and the board of the Texas School Nurse Organization. I provide support to those working in school health, not only in Region 4, but also across the state of Texas. And not all education service centers have a school health specialist, so I'm here for everybody. It's interesting, though, that I'm responsible for administration of the COVID-19 school health staffing grant with the goal of increasing school health nursing positions and school health staffing across Region 4. So since this federal grant rolled out in 2021, so much school health support has been available to schools and kiddos across the state, and it's been a very exciting time. So we're hoping to continue that work moving forward after the grant expires in March. Alice?
Perfect. Thank you. Thank you, Randy. Well, as y'all can all see, we've got representation from nursing to community members to parents to SHAC. And so my first question to the team, to the panel here is, so some of you mentioned, some pervasive issues that you're finding. Brandy, you just mentioned a few there with nursing. What are the most challenging issues that you see students are facing in your school districts And what are y'all doing to find some of those solutions currently? Amanda, I'm going to start with you.
Pressure is on, so thank you. While there's many challenges in the education setting, I think forefront with the new legislation, we're really trying to figure out how to address this tobacco and vaping issue. I know it ties in also with mental health. So we're just trying to do a lot of prevention education, cessation education. We really believe, and our SHAC here really believes as well, that prevention is key. So our focus is on that. We do have partnerships through MD Anderson, Aspire team. So we are using some evidence-based curriculum. We're really pushing that out through our student wellness interventionist, and then in the junior high and high school setting through our PE departments, and then also in high school with our health classrooms. We also have partnerships with BACODA, our Bay Area Coalition on Drugs and Alcohol. They've been providing training, unfortunately, on how to use Narcan. Whenever we think about vaping and tobacco, there's also that concern for the fentanyl usage. So when we talk about the large challenges, those are the challenges that are scaring us in ways. And the main thing is that we are focusing on, making sure that we're supporting our teachers, supporting our families and our community members. But BACODA has come in and done some training for our coaching staff, our trainers, our police officers, our nurses in our schools. And then on the flip side, like I said, we're trying to make sure that we're educating our students and families. So with our School Health Advisory Council, we're doing several presentations. And then as of right now, as we speak, we have a student that is a high school student. She's a part of a group called Peers Against Tobacco. And she is providing some peer-to-peer presentation on the dangers of vaping and tobacco usage. So we're really excited about that, because we feel like that was one thing that we were missing, was needing that peer-to-peer interaction. So we're definitely looking forward to hearing how that goes to this afternoon. But really, when I think about the most challenging issues, it's really dealing with that, and that all ties in with the mental health and in general. So that's what I would say right now is the big topic here in our district,
in your area. Thank you, Allison.
I would say our biggest challenge within Fort Bend ISD, and for those who might not know, Fort Bend is a suburb of Houston. We're kind of in the Sugar Land, Missouri, Stafford, Arcola corner of Houston. We are the most diverse county in the United States. So right now, mental health and addressing the stigma, not only with the students, but with the parents. So we find that the students are starting to get more comfortable talking about mental health, having an awareness, seeking out the support. But sometimes, especially in our extremely diverse community, how do you get the family involved? How does the family support it? How do you break down those barriers of, no, you're strong, you can do it. If it's a 98, it's not good enough. You need to make a 99 or 100. So the kids have that pressure, but how do we work with those families and get them to lessen the pressure on the students? Our district, I think a couple of days ago, just did a fantastic student-led webinar where the students asked the questions, the counselors, it was cute. They passed the ball, and then the counselors passed the ball to the next student. We have 12 high school campuses. And so I think 11 of our 12 high schools were represented on that webinar. But getting the students involved was incredibly powerful. So our district, I think, is really innovative in how we're approaching it. We do have counselors. We have 6 counselors that are available for the students that maybe aren't reaching psychological help in an external environment, in a private setting. But we do have that kind of catch where those therapists are available, and utilizing some different grants so that mental health can be available. But once again, we have to have that parent support that's signing off that their child could have counseling. So thank you.
That's wonderful. Yes. Okay, let's see. Luce, what have you seen in your discussions with serving on shacks, or just in conversations with school leaders?
Yes, so in working with the various school districts, educators have expressed concerns about students poor food choices, sedentary lifestyles, and the rise of childhood obesity. So educators often raise concerns that many students skip breakfast, often even lunch for various reasons, including time constraints and long lunch lines. Others concerns include high intake of sugar-sweetened beverages. So as childhood obesity rates continue to rise, the importance of fostering nutritious dietary habits and encouraging physical education cannot be overlooked. Physical education and nutrition education play a vital role in addressing these challenges. In response to these challenges, I've seen local school districts employing evidence-based curriculum, like through EFNIP, partnerships with community organizations, and working with AFHK is also important in addressing these challenges. Some solutions I have seen in local school districts include offering different options, lunch options, like they have different to-go boxes where they can just grab it right away, and it comes with like a sandwich, the basic nutritious meals. They are having breakfast in the classrooms to address the issue of children not going to school without having breakfast in the mornings. Also, like I've working with the other agencies and food pantries in school to address food insecurity, and also collaborating with Extension and providing these evidence-based curriculum is very important, and that's what I've been working hard in with the school districts to use us as a resource, and Extension is there, as a resource for the school districts as expertise for those schools.
Perfect. Thank you. Brandy.
I think this is a very interesting topic. Recently, we had our school safety expo at Region 4, and I was listening to a superintendent kind of discuss a similar topic. And this is what sticks with me. He said that he made one profound statement. I lose sleep at night every night wondering if I have made the right decision to keep our students safe. So he went on to say that he understands what needs to be done, but that he is being faced with things like having 5 open positions, for example, a school police officer, and we know there's new legislation there, a 3rd grade math teacher, a school nurse, a classroom paraprofessional, and a counselor, but only the budget for one, and having to make the choice for who do I choose and what area do I neglect, because this is all the money that I have. And what a tough decision that is for districts right now. And when looking at him making this confession and looking around the room, you see so many heads nodding, that so many districts, and I know that's not only in Region 4, that's probably across the state of Texas, being forced with budgetary restrictions and being forced to choose on mental health, school safety, school health, and physical health. How do you make that call?
That is such an important statement, Brandy. You're absolutely right. I think each one of you has mentioned, a different topic that is of great importance. And so how is the school going to begin to impact that when those are big issues? Now, on our end, so a question I have for y'all, something else that we hear about and we might even see about on a local news or national news front is learning loss. We like to think, and many of us, you don't want to hear post-pandemic or, post, you keep thinking, oh, can we just stop, after the pandemic. However, we do still see that in lots of dialogue about learning loss that happened during the pandemic, and that, for school districts, those academics are important. And Allison, I really took to heart what you said about the fact that there is so much pressure that is put on kids regarding the academics. What are your school districts doing? What have you heard are some of the strategies that they are utilizing to impact learning loss? And how is that balancing out with other things like the arts or physical education, recess, etc.? Let's touch on that for a little bit, because I think that that speaks. And Brandy, you're on screen, so I'm going to let you go first.
So I actually don't have an answer about how Region 4 is supporting dealing with learning loss, because I don't know. But what I do know is that from the school health side of things, we could see post-COVID, just for example, a regular day in the clinic, kindergarten students coming in when they came back were unbelievably different than kindergarten students, for example, prior to COVID. So what we were seeing is that we were having to, even in the clinic, vision and hearing screening. The students weren't understanding standing in a line, hands to self, being quiet, the basic social. So learning loss in the classroom, I can only imagine if regular social skills were impacted that greatly, and just getting the 5-year-olds to be able to match the HOTV so that I can test their vision, or to follow simple instructions, raise your hands when you hear the beep. If that was such a challenge for me, I cannot imagine what was happening in the classroom.
Great points. Great points. Amanda, give us a little school perspective.
And I feel like I'm in the same boat as Brandy, that I don't necessarily have a specific solution about the learning loss. I did read somewhere where they titled it interrupted learning instead of learning loss, because I feel looking from the outside in to our curriculum instruction, our academic side, our school district seems to overall be faring pretty well. Now, when we look at the school health side, we're doing everything that we can to increase academic achievement, because here in Goose Creek, we want to develop the whole child. We have specific, we want to make sure we're providing those safe and secure environments. We're doing everything that we can to make sure that those students that they have all the tools that they need to learn and grow, not just academically but overall. But we're talking about that learning loss, or that increase in academic achievement. I feel like it's important to reflect on, are we making sure that the students are fed? Are we making sure that they are getting their rest? Are we making sure that we're creating these environments where learning can take place? And from the SHAC perspective, and from the school health side, we're doing everything I feel that we can, and I feel like it seems to be working. I mean, of course, yes, we have, like Brandy said again about our kindergartners, I hear from some of our teachers, oh, these behaviors. It's not just kindergarten, it's some of our fifth grade, it can be all over with behaviors. But the progress, I feel like, is getting there. It's just interventions. They're having to really hone in on interventions. And you mentioned, Alice, about the time. Maybe if I specifically know that our PE time actually has increased for elementary this year, which in turn provides for our teachers to really hone in on those students that that need that extra intervention. They can plan. That opens up time for the staff to be able to plan for those interventions. And so I feel like here we're stepping the right direction when it comes to that. What do we call it? I don't necessarily want to say learning, but interrupted learning.
Interrupted.
Yes.
I like that. I like that. I wrote that down, Amanda, because I have to say I do like that term better than learning loss. And I'm also very happy to hear that that physical activity time has not been necessarily pulled away, because unfortunately, I know I have heard from several school districts that is the scenario, unfortunately. So kudos to Goose Creek. That's awesome. Yeah, I think that's a great approach. Um, Luce, what do you hear around the El Paso area?
So, like, as far as my daughters go, I know they've really been pushing on the extra tutoring after school and providing a lot more than they used to prior. But and this next thing I'm going to talk about, I don't know exactly if it was done because of learning loss, but we did have one school district in El Paso County that reduced the PE time for elementary schools to 4 days a week instead of 5. And there is talk, that next couple of years they're going to reduce it even further. The day students do not have physical education. They have it's replaced with the fine arts class. So the response I did read from the school district was that they are meeting the state's requirement for physical education. And although they reduced the number of days, they increased the amount of recess time to, I believe it was 20 minutes. But when school districts are making these decisions, I feel they need to continue evaluating the effects of the changes and ensure that the students' physical needs are still being met.
That's a great, excellent point. Absolutely, absolutely. And Luce, that is not unlike what we have heard at some places across the state. So yes, unfortunately. Allison.
Okay, a couple things our district is doing. I'm not an educator by background, but some of you might have heard this term. So we're trying to get a +1 growth year with every student. So if they come in as a second grader, we want them to develop +1 educational year by the time they finish that academic year. We are doing a lot of assessments, and I think that is super important to start with, where are these kids? Assessing them at regular intervals. Is there progress being made? So that's fantastic that Fort Bend is so involved with that. The other thing is we have a policy. Our wellness policy does state that 5 days a week our elementary kids will have recess for 30 minutes. So thankfully the Board of Trustees and our wellness policy currently still has that. Our elementary kids also get 2 well, I don't know about the time, but anyway, 2 PE classes per week. And we're actually trying to promote physical activity as an incentive. So, providing that motivation of, oh, you might get 5 extra minutes of recess if, you learn the spelling words or, whatever. I will say too, another thing that Fort Bend does very well is we have good systems and structures in place for expectations. The kids have the expectations of what's involved, and when disruptive behaviors occur, the problem is solved fairly quickly. So I think having those systems in place can be helpful for any district, whether it's an acronym, PRIDE, GO, whatever that is. The students have that expectation, hands to themselves, mouths closed, walk in a line, everybody knows. And when you have a little bit more orderly organization and systems, then more academic learning can occur.
Yeah, excellent strategies, excellent strategies. I think, the interrupted learning that has transpired, as we all know, it's continuous. There's going to have to be ebb and flow throughout to either make up for some of those social skills that might have fallen by the wayside just because of the out of school environment or whatever the factors are that might be leading to this. Kind of want to go back to a couple of the points that several of you mentioned during our first question about most challenging. I'd kind of like to look a little bit further into that mental health and social emotional stress, because that is such a pervasive topic as well. Not only for students but for staff. I've actually had hard conversations with some school leaders regarding, staff wellness as well, and just the added pressure we think about. And Allison, I'm going to start with you in a minute here. You brought up that great point about the pressure that kids are feeling on them, whether it's coming from parents or whether it's just internal to, that 98 was not good enough. It had to be 100 on that test or on that homework assignment. We're also hearing that stress on teachers because are their kids performing at the very best level that they can, and what are they doing? So my question to y'all is, do you have any programs, or are there strategies that your districts that you're aware of in your area are utilizing or employing to help with mental health, either for students or staff? So Allison?
Okay, I do know that Fort Bend does have a private EAP, Employee Assistance Program for the staff, and they are all encouraged to utilize the EAP. One other kind of thing that came out of the PTOs and PTAs on our campuses is some of the parents have volunteered to relieve staff so that they might be able to run an errand, something like that. That was a really interesting organic thing that happened. And so letting these parents know who are wanting to help and volunteer, if they're background checked, hey, can they come do parking lot duty? One of our campuses does Friday Dad's Day, and our Dad's Club, does the parking. So then the teachers have 20 or 30 extra minutes to plan. So those are terrific. I think a couple of minutes ago, I alluded to some of the mental health supports that our students are getting. The VOCA grant was a big one, utilizing the 6 counselors, helping the kids on Medicaid get connected. If our students have private insurance, connecting the parents with that private insurance. My daughter was actually one that was able to use one of those private counselors during the COVID epidemic. And, just making aware, having the parents be aware that these resources are available.
I love what you said about that parent engagement piece, because, having dads help with parking, or, whatever the whether it could be, somebody coming in and helping read a book for kids, in a class, for, that those are excellent ways. And I think that gets to the heart of what, as a steering committee, we really recognize. And I'm preaching to the choir, but it really takes all facets. It has to be parents recognizing that it's okay to kind of come back up to school. I had a conversation with a colleague earlier this week who said, for some parents, they kind of felt like they've pulled away from school because of all of the COVID stuff, and now it's okay to start getting involved, obviously with background checks and so forth approved, but to start getting involved with PTOs, with PTAs, on shacks, with athletic booster club, with whatever involvement, so that their voice, and they can help be part of the solution, especially when it's coming to maybe staff needing a little break, a little extra time, having a helper, if you will, a room helper, that can be there for them. So great ideas, and thanks for sharing some of what Fort Bend is doing. Amanda?
Well, again, just to kind of add to, I love the idea of the parent engagement piece. That made me think about, we have at some of our elementary campuses, we have the watchdog dads, and it just gives the dads an opportunity to go to the schools and help out during, like they said, in the morning time, and sometimes during lunchtime as well. So I love that piece. And then as far as staff goes, I want to add, over here in Goose Creek, we have a fitness center that's available to all of our staff members. And so that's something that's unique. and very important for mental health, because then we have a place that we can go to utilize that fitness center area. We also have resources such as the EIP to be able to use. We have an employee wellness clinic, and so there's specific things district-wide that are promoting that side of physical health in order to address the mental health as well of our staff. At the campus level for staff, we have Wellness on the Go that's been implemented by our social emotional and student learning student wellness department. And those Wellness on the Goes, they actively promote like relationship building with staff, gives them an opportunity just to have a way to have a mental health break, whether that's, even if it's something like as simple as sitting down and being able to color a color sheet, or going to the calming areas. So many of our campuses have calming areas. It's pretty much a room that's provided as a relaxation area for staff. Many of the teachers enjoy that, to be able to just take during the instructional day, just to kind of take a moment to relieve their stress and enjoy a nice comfy place to sit and relax, maybe listen to some calming music as well. And then they're also encouraged again at their campus to get out and do some walking, just walk and talk, and again, take a mental health break there. As far as our students, we definitely take a trauma-informed approach. Everything is with that lens. Just spoke with our mental health and behavior coordinator from that department yesterday, and she said everything that they do is really with the trauma-informed care lens. So they want to make sure that the students are building those relationships on their level as well, and having an inclusive community. They just started in a couple of SEL programs. One of them this year we did with Start with Hello, and it's also part of our anti-bullying committee as well. But it's really about building relationships, starting with hello, and really showing the students how to build that social connection, which will help with the mental side. The students also participate in Character Strong, which is evidence-based SEL curriculum, and that's taught within the classroom. We have Wellness Wednesdays across the district as well. And the last thing I would like to say is that we're supported far and beyond here in Goose Creek. We have 12 student wellness interventionists for our district. We work with communities and schools at the secondary level. We have KAIS workers for the elementary level, and then that department has also created a lot of partnership with agencies such as DePelchin. They send out questionnaires to persuade and refer things. They do trainings for the district. The Harris Center here nearby also provides the resources. T-Chat also, Spindletop and Bakota also support our social emotional and mental health side here in Goose Creek.
That is a incredibly robust
They do
list
a lot.
no, but that's fantastic. And I think that really helps again tie in what we know as the whole child. It really is everybody pitching in, and I think the more effective you can be is really when you're pulling together the parents and the community and the staff. So that's fantastic, Amanda. Great, wonderful tips and ideas there. Luce, what do you hear in your area?
Well, with the EFNET program, within the EFNET program, we place a strong emphasis on the importance of healthy eating and regular physical activity, recognizing that physical activity and healthy eating plays a major role in the students' mental well-being. In the capacity of attending various SHAC meetings, mental health for staff and students has been a topic of discussion, and there's a lot of different programs being implemented in the school districts from community partners. They also have the Wellness Wednesday, which that's where they mainly include the EFNET program in their Wellness Wednesdays. It's well established that a balanced diet and regular exercise contributes not only to physical health, but mental health. These practices have the potential to impact various aspects of children's well-being, including their cognition, their focus, their mood or behavior, It helps decrease anxiety. It improves their sleep patterns, and increases their self-esteem. So empowering the students to make healthier choices can have a positive outcome on the students' mental health.
Perfect. Thank you. Yes, absolutely. Brandy.
I would love to go back to what Allison said about the EAP for employee social and emotional health. That I did not really understand or know about that program until probably last year. And what a great program it is. And it makes so many things free to you, especially in the beginning. And just sometimes just having someone to listen, being able to press that button and make that call and know that it's free, especially the crisis part of that program. So I love that Region 4 offers that. And it's my understanding that that's a TRS thing that's throughout anyone who has TRS active care insurance, like most teachers in Texas who choose to do that. So I really love that that's an option there. But let me add that at Region 4, we are so excited to have some structural changes that have happened. And within the center, we had a whole new division form. The Office of Emergency Management and School Safety was born, I'm going to say, on September 1st of this year. Within that new division, we have school safety experts, we have emergency management experts, of course, myself supporting school health, but also a huge team of school mental and behavioral health professionals. They outnumber the rest of us by far, and they're there poised and ready to support districts across Region 4, and they go all around the state of Texas, to be honest, with any mental and behavioral health needs. So I love being a part of their team and knowing that they're there. Their list of course offerings is just out of this world.
Wow. That is fantastic. What a resource. I know that you would be willing to share some of the programs that, or, talk a little bit more about some of those programs, and can get us some of that information that we can pass out as resources when we send a follow-up. Okay, fantastic. A couple of you have mentioned youth voice and talked a little bit about how you've included peer-to-peer education, or how you have found certain components where peers are taking a larger role in some of the kind of solutions and problem solving of some of these matters, health issues. So tell us a little bit more about how the youth voice matters in your district, and how is it really, working? What opportunities do they have, and are you seeing that it's making a difference? And so let's start with Allison.
Oh, I was hoping you'd call on me. Our Board of Trustees recently kind of elected or offered the students that our high school students could be part of a district student wellness coalition. So within our 12 high schools, we had 4 students that were selected to represent their campuses. And so every SHAC meeting starting in September, we are having these 48 students attend the SHAC meeting in addition to our, typical 30 to 50 other people. So I was so excited. The kids are getting cords. So in high school, you get to have certain, cords when you graduate. That was included because this is going to be under a student leadership category. So the Board of Trustees was very instrumental in helping that class roll out. So we're so excited. It's brought a lot of energy to the SHAC meeting. The kids are really involved, and they take that information back to their campus. And what I'm super excited about is United Healthcare donated money. I'm not sure the amount, but we have a certain amount of funds, and the kids in November are going to compete against each other And we have 3 campuses that will be awarded first, second, and third place. And the money can go for implementing their wellness idea. So last year, United Healthcare gave us $2,500, and we broke that into the 3 campuses. We had a campus wellness mental health room. We had a pet day that one of our high schools was able to bring their pets to campus. And I forgot what the third one was, but anyway, so that was really helpful with our community partner of United Healthcare. And the kids are just really excited. They're going back to their home campuses, talking, amongst even my high school. There were 30 kids in our interest meeting. So there's a lot of enthusiasm building within our campuses, and especially having this little competition with money attached. So I'm very excited about what we're doing.
I love that. And I love that the students are getting to really have input into how the structure of their involvement is going to be, and then they'll have accolades for it upon graduation in their leadership. And so building future leaders that are health minded leaders. So that's fantastic. Great job. Well, y'all really are rocking over there in Fort Bend. Brandy, tell us about the youth voice. And I know you're at the ESC in District 4, so you probably don't have as much, but have you heard much from school districts in your area?
No, unfortunately, this is not the youth voice is not something that I get to work with anymore, since not being on a campus. But I can tell you that the service center as a whole definitely utilizes surveys of parents, students, and staff to see what needs are out there while developing programming to support districts in every aspect. So I imagine that that's the biggest thing for us at the service center level, is just utilizing the data to develop new up and coming course offerings.
But I will say, Brandy, thank you as a parent myself. Thank you for including parents and community leaders and others in some of those surveys for that development. Having those actual assessment pieces and participation at just asking is valuable. And so it's good to know that y'all utilize that in the development of some of those pieces. Super, thank you. Luce.
Yes, so in one of the SHAC meetings I attended, they did have a panel of students that they invited, and they provided the students an opportunity to share their opinions and their experiences about different topics. Just like we're having a panel here today. It was the same concept with a panel of students, and I felt that was a great way to hear the students' opinions and experience firsthand, and it was a great way to see how the schools can improve. So for students to have a voice, students need to be provided opportunities to learn about and participate in various types of meetings and in health education activities.
Yeah, being part of that solution for certain is a way to certainly have more support and buy-in.
Yes.
Amanda.
Okay, so I mentioned earlier, we today have a peer-to-peer teaching happening. High school students actually presenting to peers about the dangers of vaping and tobacco. It is our Red Ribbon Week this week, so it was a goal to try to have this done this week. So we're really excited and think that will be something that's really powerful and to reflect on. The other ideas that I kind of thought about were, we have an anti-bullying committee. Students are actively engaged on that anti-bullying committee. It's not a subcommittee of our School Health Advisory Council. It's a separate committee in itself, but those members are housed at their campus, but they also meet as a district as well. So really getting the to the bottom of the school culture and the climate, and and understanding where those students are coming from when it refers to anti-bullying. It has been a goal of mine, so I'm really jealous of Allison and Fort Bend ISD. This is going into my fourth year as SHAC facilitator, and one of our goals is to have that youth voice on our school health advisory council. So our idea for the SHAC for this year is to form a youth SHAC by just training a parent. We want a parent, a staff member, a community member. That's the idea that we're going for, to be the mentor of the sponsors. Now we have mentors and sponsorships, and we have clubs and different activities that are going on within the campuses. That could even be student council members that are providing their voice, but we wanted it to really be specific to health and wellness. I know it all goes hand in hand, but we do want it to be wellness. So I like that she called it what is it, your Student Wellness Coalition. So, and I love that you are backed, Allison, by your school board. So I think that's another ticket that we need to look into, as well as getting the support from them. So that's a wonderful idea. We also, our nutrition services department, because we really haven't talked too much about them, they have also worked, like our registered dietitian, she's pulled in student groups and really had focus groups on, what are the students' likes or dislikes on the menu, and really tried to do some education with them as well, based on the standards that they are having to abide by with nutrition services. So we have student voice intermittently, but I would like to make it similar to Allison that she was saying with Fort Bend, to where we have a standing kind of ad hoc committee of youth that are providing that information. So that's something that we are working on, but we know how very important it is to have the youth voice within our district.
Perfect. Thank you. And it sounds like y'all are making strides already, some really good strides at getting there. Absolutely. Another really good ideas. I love this, is like lots of great sharing and ideas coming across from each of you. One of the points that I have heard each and every one of you mention, every one of you has mentioned SHAC at some point, which are the school health advisory councils. I would love to hear from you and your thoughts on, how effective is your SHAC been in your area, or what are how are they working to really be the voice for local values, for local parents and community? Tell us a little bit more about how your SHAC is working, just to kind of expand on that, if you wouldn't, and some of what are they really tackling. Brandy, we're going to start with you now. What do you hear about SHACs in the region?
Well, we have a SHAC leadership network that is pretty much led by our school mental health team, and they run the leadership network, and that is basically filled with leaders from the different ISDs within Region 4, where they can come together and basically brainstorm, collaborate, what's best practice. They present new information, new legislation, that sort of thing, give guidance. And really, that's what Region 4's part is in SHACs, where that is concerned. And that, I feel like that is just providing a good way for a sounding board to hear what within the region, what they're all doing and how they can grow, and what is best practice, what is advised, what is working, what is not working within the regions.
That's fantastic. So I want to follow up with you, Brandy. So this is out of your District 4 office, the mental health team. So it's like it's almost like a you said representatives, SHAC representatives from all the districts are kind of part of this little network. Is that what I heard?
So this is a leadership network, and they have a roster of different district SHAC leaders from within Region 4, and they offer a meeting. I'm not sure how often that they collaborate, but they offer a meeting where they get together and collaborate on what is best practice. And again, especially legislation, when
Mhm.
things are new and people don't know what's going on and what they should do and what the rules are and that sort of thing, they work together to talk through some of those things, bring in legislative experts and support the districts there
Fantastic.
on how to move forward.
That's wonderful. Great. Thank you. Okay. Let's hear from Allison.
Okay, one of the things as a chair that I was hoping to do is have effective and then also engaging meetings. I think that's very pivotal. If you don't have meetings that engage the participants for that hour to 2 hours, then you're going to lose participants. We do have what I call a strategy grid. So again, it's a system put in place where every meeting, we know what the theme is, we know who the main speaker is, what policy are we going to address, and then any other action items. At the end of every meeting, we have a SHAC action item. So these are anywhere from 3 to 7 action items that the members can take back to their campus, their community. You know, it might be look into grants or participate in a community fun run, you know, at the campus level. So we have that action. So, you know, if people say, what am I doing for an hour and a half? What am I going to do at the end? Take those resources back. So those are two things that I think. We also, as a parent component, have evaluated our health education policy. So SHAC has 40 members in our district, and we asked for parent volunteers to review the health education curriculum. We had 3 parents that had that voice that went back and forth with the teachers and the administration and voted on the health policy. And then the same thing for the human trafficking, domestic violence, that curriculum also, we solicited parent volunteers to participate so that the parents felt like they did have a voice in the SHAC. So I think that's pivotal too, is making sure that those SHAC parent members feel like they have a voice, and it just propagates their interest, right? They have a vested interest because they've evaluated the curriculum.
That's fantastic. Absolutely. And I think having that parental role really is important, because they can also be your champions amongst other parents in other groups. If you've got, we often talk about, especially in small school districts, if you've got a limited number of parents, they're serving on maybe 3 or 4 different groups or committees, it's great to ensure that you've got a really active parent on the SHAC who can spread the word and help get the messaging, the healthful messaging and the goals and the strategies of what SHACs are wanting to do out to other communities or other community members, and other parents. So that's fantastic. I love the setup that y'all have, and I really like action items. I like having that as a takeaway, so that people are walking away with their takeaway. I am responsible for X, Y, and Z. So
Yeah,
that's
and if I could just follow up with a question. So the SHAC reviewed, the small subcommittee reviewed the the health education curriculum, and then also the domestic violence. We had 2 separate subgroups that met. We did come back and present, and the entire SHAC voted on both of those 2. So yes.
perfect. Perfect. Excellent. Okay, Luce. Uh-oh, Luce, I think you're on mute.
Yes, sorry. So SAC has an essential role in advocating for health and well-being of students and their connection to their academic outcome. So it's very encouraging to see school districts recognizing the importance of bringing resources into the schools to strengthen the link between health and learning. The challenge I've seen in some of the SHACs include parent involvement in the SHACs. So it's very important in engaging parents in the process to ensure that the members represents the diverse needs and perspectives of the community. Here in El Paso, the Healthy Kids Coalition has provided resources and trainings for SHACs to strengthen their needs. They're also working on establishing a regional SHAC, and they're in the beginning process of this in the area to help provide guidance and share, best practices for the development of effective and sustainable shacks, and to contribute to the overall health and academic success of our students.
That's perfect. And it sounds like, yeah, y'all are working to somewhat, do something similar to what Brandy and Region 4 is doing, where they're able to pull together those specific leaders from shacks and have them convene at some point to, as you mentioned, share best practices or talk through resources that they could all utilize, etc. So that's fantastic to hear the progress that y'all are making there as well. Thank you. Amanda.
Almost forgot to unmute. So I feel like our shack definitely has become more and more effective as a voice for parents in the community. And honestly, I want to just kind of say thank you to you, Alice, to Ms. Smith. And we have some friends here I see online from Pasadena ISD. It really is, the success has become from ideas that we've all shared, because I've noticed that no two shacks are alike. But I love taking ideas from one another. I love the engagement piece. I love, just like she was saying about the policy of the action items, as you said. So I love that. So thank y'all all for sharing, your experiences and making our shack better here in Goose Creek CISD. So we actually are really proud to say we have 51 members in our diverse shack. We have 24 returning from last year. So that was very powerful to me to say, wow, we have so many members that are wanting to stay engaged because we kind of just revised or revamped our shack about 3 years ago. And so it's really nice to see that we have members that are wanting to return. So that tells me as the facilitator that my goal to, just create an environment where we can genuinely collaborate with one another, that they're trusting the process that we're going through, that they feel like they can share decision makings. That's really important to me as the facilitator, that we have, that feeling within the room and within our subcommittees, and that way we can make those effective recommendations that positively impact our students' health and staff health. We have 4 standing subcommittees on our shack. We have also an ad hoc committee that will review our wellness plan and measure that as we go along throughout the year. We actually had about 25 subcommittee meetings this past school year. So in addition to the 5 general meetings that we had. So whenever we think about, the mandate that we have to have at least 4 meetings, it doesn't stop there. The decision-making, the majority of our work happens within our subcommittee meetings. And that's really where I feel like a lot of the engagement occurs. We garner some feedback from the community, whether that's just like some of you have shared about recommending the human sexuality instruction, supporting textbook recommendations, implementing that wellness plan that I talked about. So really feel like our shack has been effective in that. And again, kudos to our campus committees too, because we have a corollary to our school health advisory councils. We have wellness committees on all of our campuses as well, and they're led by a champion. And that champion, a lot of those champions also are representative at our school health advisory council. Whether they've been an appointed member or not, they are welcome to come to our meetings, and then they relay the information back and forth to the campuses. But I do like the idea, again, of that action item, because then that will give them something to take back and do and show. And that kind of correlates also with our coordinated school health plan. We send home a 1-pager, or send to the campuses each grading period. We send a 1-pager with coordinated school health tasks. And so each area will have a main theme that they are responsible for on the campus, but it challenges them, whether that's a staff challenge, whether it's an administrative challenge, whether they're doing nutrition fact of the day on the morning announcements. But everybody on the campus level would have a role or a task to do, and then we are measuring that through surveys and assessments, and then we report that within our school health advisory council meetings, and we get to celebrate that. And so I think that's important too, is to celebrate your success with your shack. So when you have that parent and community engagement, really celebrate even the smallest wins, and you'll get a lot of great feedback, information, and people will want to be a part of that process. Thank you.
I love that because yes, that is just a fantastic point. All too often we all get so very busy and we just kind of keep moving forward with what's next on the list, what's next on the list. But I love the idea of one, having the action items, and two, these tasks that you mentioned, and then just taking a break and stepping back to celebrate when you've met one or two or more of those, and to say, hey, this was an overarching goal for this group. We were, going to do X, and look, we did it. And so great way to encourage more. I mean, everybody wants to be part of a winning team, right? So this is a great way to celebrate some of those wins, even if they're small sometimes. So I love that. Great idea, Amanda. Okay, I am going to pause for a second and open up for questions. We've heard some amazing information throughout.
There was one question, Alice, about resources, and I think they were referring to the mental health resources that Brandy was talking about, and wanted to know what organization those were through that should be available to everybody that's on the Brandy, do you remember?
It's just the Region 4 Education Service Center. There's a whole search professional development. You can put in a keyword mental health of, anything social emotional learning, anything that you think you could possibly search. You just search it and their list pops up there on the Region 4 website.
Wow. Okay. So just Region 4, is it Region 4 ESC?
Education Service Center, yes.
Okay. Perfect. Thank you. Okay, other comments or questions? We have about 5 minutes left in our session. We wanted to leave it open for some additional questions or thoughts, comments.
Allison has something she wants to add.
Yes.
When we were talking about student engagement, one of the things that our district is doing is, it's actually on Thursday, we have what's called a food fair. So our child nutrition department invites the 20 or 25 vendors that service our C&D, and we invite the whole district. Students are allowed to scan a QR code, and then they can vote on items that they like. And the child nutrition department really tries to utilize that and use the vendors or the products that the students like. Also, last year, our career and technical education culinary department had its own Chopped competition. And the winner of the Chopped competition, C&D, Child Nutrition Department, was able to kind of tweak it, make sure it was smart snack appropriate. And we've implemented 2 new menu items, one because of the Chopped competition, and then a second one, we had an elementary contest where the kids could come up with their own recipes. And we featured, I think, one of our 4th graders who did a little burrito or taco. And so we had 2 new menu items that were student driven. And then that food fair to solicit the kids' input and the parents' input as well.
I love that idea. I do know that several schools utilize taste testing with their various students and allow them to, decide on, this or that, which they preferred. However, you've taken it, your district has taken it a step further. They're not just taste testing, they're actually being innovative and creative in developing the recipes. And so that is fantastic. I love that. Wonderful, wonderful. Amanda, we've had a question related come up for you about the employee wellness center that you kind of highlighted. Do you know a little bit about how that wellness center was funded? Did the school district, fund that themselves? Was it a grant, or how do you know much about that?
Not exactly sure. I was trying to look on our website to see if I could answer the question. I know we had a partnership with some Methodist to do some of the graphics and things on the inside. But I'm trying to see on here if there was a specific or if it was part of something that we had. But I'll try to reflect back on that in the chat. But I don't know that I have the answer to that right now.
That you have the answer. How is it utilized? I mean, as far as do you got a good participation? Is it very well?
Pretty good participation. We have our benefits director has a wellness program that she promotes. So the staff members that utilize it, every 30-minute workout per day, you get so many points and you can earn different recognitions. So if you get a certain number of points, you get recognition even at a board meeting. But then, there's smaller recognitions where you can get whether it's a water bottle or a Yeti cup or a fitness watch, really nice polo shirt, and actually a nice award plaque as well. So that's mainly through our benefits department. She will promote that. And in that fitness center, there's cardio equipment, there's machines, there's free weights, there's yoga equipment. And so it's really promoted. And then, we try to, along with our It's Time Texas Community Challenge, we always promote, and try to make sure that we're communicating. That's one of the things that we really want to be even clearer with our School Health Advisory Council, is communicating those resources. And the Wellness Center is a great way for our staff members to get, have a healthy environment.
Perfect. Well, we are winding down our session. I want to say a tremendous thank you to all of our panelists today and to everyone who is on and participating and listening. I hope that you have gotten a good feel for exactly, the work and the people, the beautiful, the advantage that we all see in having this interdisciplinary sort of, all of us, whether as a parent, as a school leader, as a nurse, as a SHAC member, as a community partner, all working together, we can really make things happen in the arenas of school health and wellness. And so thank you to our panelists. What we're going to do now is give everybody a quick 10-minute break so we can stand up and stretch and